Hyperlipidemia is a metabolic disease. Look at this picture, shows that disease mechanism. Plaques in the arteries. Look at this detail going on. Introduction. Hyperlipidemia is a medical condition characterized by abnormality, elevated levels of lipids or lipoproteins in the blood. These lipids include cholesterol and triglycerides, which are essential for normal bodily functions but can become harmful when present in excessive amounts. Hyperlipidemia is a major risk factor for cardiovascular diseases, including atherosclerosis, coronary artery diseases, and stroke. Definition: hyperlipidemia is defined as an abnormal elevation of one or more type of lipids in the blood. It is typically classified based on the type of lipid that is elevated. Hypercholesterolemia, elevated levels of cholesterol. Hypertriglyceridemia, elevated levels of triglycerides. Mixed hyperlipidemia, elevated levels of both cholesterol and triglycerides. Types: primary hyperlipidemia, genetic causes. 1. Familial hypercholesterolemia, a genetic disorder leading to higher cholesterol levels. 2. Familial combined hyperlipidemia, a genetic disorder causing elevated cholesterol and triglycerides. Three, familial hypertriglyceridemia, a genetic disorder causing elevated triglycerides. 3. Polygenic hyperlipidemia caused by the interaction of multiple genes, often influenced by lifestyle factors. Secondary hyperlipidemia. 1. Dietary factors, high intake of saturated fats, trans fats, and cholesterol rich foods. 2. Medical conditions, diabetes mellitus, hypothyroidism, nephrotic syndrome, chronic kidney disease, liver disease, and obesity. 3. Medications, certain drugs like beta blockers, diuretics, corticosteroids, and oral contraceptives leads to hyperlipidemia. Causes: 1. Genetic predisposition, inherited mutations can affect lipid metabolism. 2. Lifestyle factors, high fat diet, sedentary lifestyle, excessive alcohol intake, and smoking. 3. Medical conditions, disease like diabetes, hypothyroidism, chronic kidney diseases can impair lipid metabolism. 4. Medication. Certain medications can elevate lipid levels. Risk factors. 1. Age. Risk increase with age. 2. Gender. Men are at high risk, but the risk increases in women after menopause. 3. Family history. A family history of hyperlipidemia or cardiovascular diseases. 4. Obesity. Excess body weight contributes to abnormal lipid levels. 5. Sedentary lifestyle. Lack of physical activity can lead to elevated lipid levels. 6. Unhealthy diet. A diet high in saturated and trans fats. Complications. 1. Atherosclerosis. Build-up of plaque in arteries leading to narrowing and reduced blood flow. 2. Coronary artery disease. Reduced blood flow to the heart muscles, increasing the risk of heart attacks. 3. Stroke. Reduced blood flow to the brain due to plaque buildup. 4. Peripheral artery disease. Reduced blood flow to the limbs related to pain and ulcers. 5. Pancreatitis. Inflammation of the pancreas due to very high triglyceride level. Pathophysiology. The pathophysiology of hyperlipidemia involves several interconnected steps that leads to the abnormal accumulation of lipids in the blood and the subsequent development of cardiovascular disease. Here is step-by-step process. 1. Lipid metabolic and transport. Dietary intake, endogenous production. 2. Lipoprotein metabolism. Chylomicron metabolism, VLDL conversion. 3. LDL cholesterol and plaque formation. LDL uptake by cells, oxidation of LDL. 4. Atherosclerosis development, endothelial dysfunction, formation of fatty structures. 5. Plaque progression, fibrous plaque formation, plaque growth. 6. Plaque rupture and thrombosis, plaque instability, rupture and thrombosis formation, acute vascular events. 7. Clinical manifestations, ischemic symptoms, severe complications. 8. Chronic inflammation, ongoing inflammatory response. The pathophysiology of hyperlipidemia. involves an imbalance in lipid metabolism leading to elevated levels of LDL cholesterol. This excess LDL cholesterol undergoes oxidation, contributing to endothelial dysfunction. Plaque formation and the development of atherosclerosis, plaque progression, instability and rupture can result in acute cardiovascular events, which are the primary complication of hyperlipidemia. Signs and symptoms. 1. Asymptomatic. Often hyperlipidemia does not present with symptoms until complication arise. 2. Exanthemosis. Fatty deposits under the skin, particularly around the eyes. 3. Arvus senalis, a white or grey ring around the cornea, often seen in older adults with high cholesterol. 4. Pancreatitis, severe abdominal pain, nausea and vomiting in case of very high triglyceride levels. Diagnosis. 1. Lipid profiles, blood test measuring total cholesterol LDL, HDL and triglycerides. 2. Genetic testing for familial hyperlipidemia. Genetic testing may be conducted. 3. Other tests: blood glucose levels, thyroid function test, liver function test and kidney function test to identify underlying conditions contributing to hyperlipidemia. Nursing diagnosis. 1. Imbalanced nutrition related to excessive intake of dietary fats. 2. Risk for ineffective health maintenance related to lack of knowledge about hyperlipidemia and its management. 3. Risk for decreased cardiac output related to the potential development of coronary artery disease. 4. Risk for ineffective tissue perfusion related to atherosclerosis and reduced blood flow. 5. Anxiety related to the diagnosis of a chronic condition. Management. Lifestyle modifications including 1. Dietary changes, low fat, low cholesterol diet with increased intake of fruits, vegetables and whole grains. 2. Physical activity, regular exercise to improve lipid levels and cardiovascular health. 3. Weight management, achieving and maintaining a healthy weight. 4. Smoking cessation to reduce the risk of cardiovascular complications. 5. Alcohol moderation, limiting alcohol intake to reduce triglyceride level. Treatment. 1. Statins, first line drug to lower LDL cholesterol. 2. Fibrates, used to lower triglycerides. 3. Niacin, used to lower LDL cholesterol and triglycerides while increasing HDL cholesterol. 4. Bile acid sequestrants, drugs that reduce cholesterol absorption in the intestines. 5. PCSK9 inhibitors, monoclonal antibodies that significantly lower LDL cholesterol. 6. Ezetimibe reduce cholesterol absorption in the intestines. Psychosocial medicine. 1. Emotional impact. Diagnosis of hyperlipidemia can cause anxiety and stress. 2. Support systems. Patients may benefit from counseling or support groups to cope with lifestyle changes. 3. Patient education. Educating patients about the importance of medication, adherence, lifestyle changes, and regular monitoring. 4. Behavioral therapy can be beneficial for patients struggle with dietary changes or smoking cessation. Prevention. 1. Healthy diet. Consuming a balanced diet lower in saturated fats and cholesterol. 2. Regular exercises. Engaging in at least 150 minutes of moderate intensity exercise per week. 3. Weight management. Maintaining a healthy weight to prevent lipid abnormalities. 4. Regular screening. Lipid profile screening, especially for those with risk factors. 5. Smoking cessation. Avoiding smoking to reduce cardiovascular risk. In conclusion, hyperlipidemia is a significant health concern due to its role in the development of cardiovascular diseases. Early detection, lifestyle modifications, and appropriate treatment can effectively manage hyperlipidemia and reduce the risk of complications. Thank you. Have a good day.